This is a CJASN podcast, and I am Dr. Diana Jalal from the University of Iowa and the Iowa City VA. I am joined by Colin Gimblet, a doctoral student at the University of Iowa. Individuals with diabetes and chronic kidney disease have a heightened burden of cardiovascular morbidity and mortality that persists despite the therapeutic advances in the field. One possible explanation for this observation is impaired endothelial function. Studies consistently demonstrate that individuals with diabetic kidney disease have lower endothelial function than the general population. Importantly, interventions that improve endothelial function have been shown to impact long-term outcomes in individuals at high risk of cardiovascular disease. So, improving endothelial function could reduce cardiovascular risk in this population.
In humans, the most common way to measure endothelial function is by assessing flow-mediated dilation in the brachial artery with ultrasound. To do this, we take a 30-second baseline image of the brachial artery diameter. Next, we inflate a cuff placed on the forearm to 250 millimeters of mercury for 5 minutes. After 5 minutes, we deflate the cuff and continuously measure changes in brachial artery diameter for the next 2 minutes. Finally, we subtract the peak diameter after cuff inflation from the baseline diameter to determine endothelial function, with a greater change in diameter signifying better endothelial function.
A few years ago, we reported that wine intake was associated with a lower odds of cardiovascular disease in individuals with chronic kidney disease. This inspired us to consider whether resveratrol might improve endothelial function in those with chronic kidney disease and diabetes. Resveratrol is a polyphenolic compound found in grapes and red wine. Some studies have shown that resveratrol may improve vascular function in several high-risk groups, and yet no study to date had evaluated the supplement in individuals with chronic kidney disease.
In our study, we evaluated 25 participants with stage 3 chronic kidney disease and diabetes. We found that 400 milligrams of resveratrol per day for 6 weeks significantly improved brachial artery flow-mediated dilation compared to placebo. This improvement was independent of changes in glycemic control, blood pressure, and kidney function. Our findings suggest that resveratrol increases endothelial function by modifying endothelial cell processes rather than through systemic changes in cardiovascular risk factors.
I want to close by noting a few things. First, it takes a village to conduct clinical trials, and none of this work would have been possible without our talented and bright coordinator, Catherine Giesland. Second, it is important to recognize that this is a small pilot study. Additional work is needed to corroborate these findings and to understand the mechanisms by which resveratrol may improve endothelial function in those with chronic kidney disease and diabetes. Lastly, I want to thank CJASN for highlighting this work, especially considering the high risk of cardiovascular disease in those with chronic kidney disease.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.